Vaccine safety today is as good as it can be with the science that's available to us. And that's what parents need to understand. If they question the science, then they also have to take responsibility for the decisions that they make and what may happen, of course, in the future if their children are not vaccinated. And we don't want to think about that. We're struggling at the moment. Many parents struggle to understand why there are these rumors circulating around the vaccines and their safety. But for the large part, these are just rumors. We have very, very few cases of adverse events across the entire European region of 53 countries and 1 billion people. In this country, you haven't seen a serious adverse event for decades that is associated with the vaccine. As the public health system and public health authorities, we need to do a better job of listening to the discussion and the conversation that is happening on social media. We need to have a better understanding of what's going on and the discussions that are going on between parents and other actors on social media, so that we can do a better job of providing them with the information that they need and providing them with immunization and vaccination services in a way that is appealing to them. It's very, very alarming what is happening in Romania at the moment. We have over 4,800 cases, 21 deaths. We have over 40% of the population that are affected, the cases, over 40% of them hospitalized. It's an incredible burden in terms of, and loss in terms of human life, but also in terms of the economic cost to the country. And Bosnian people need to be aware of that. The Bosnia-Herzegovina people and nationals in this country need to be aware of that. Parents need to be aware of that, because if we continue seeing this decline, then we will see the episode that's happening in Romania occur in Bosnia-Herzegovina. We have an outbreak in Italy. Italy has higher coverage than Bosnia-Herzegovina does. But we have 1,500 cases of measles in Italy today. So the question is, how long are you going to get away with this? So in this case, you've got a country that has seen declining rates of vaccination over a sustained period of time. Measles will catch you out. Measles is one of the most contagious diseases. It exposes the smallest holes and gaps in your health system. So where you have a declining health system or a health system that isn't performing optimally, measles will find you out. So at some point you're going to have an outbreak. The question is when, not if. Now the other point that this brings forward is, if that is a given, if we assume that you will see an outbreak, I'd like to know whether the people that currently are influencing parents not to vaccinate, are they going to take responsibility for the cases when you see this outbreak? Are they going to take responsibility for the parents who might lose children to these diseases in the future? No, they won't. They won't be there to take responsibility. They will be invisible. When you come to a country where people are pushing back against, where some parents, some individuals, some caregivers, some healthcare workers push back against vaccines, it happens to a degree in every country. But in this country, it seems to be more unique in that respect. And I hope that the parents in Bosnia-Herzegovina don't pay the ultimate price for that decision in the long run. And I hope that people make the same decision that I did and vaccinate their children. Of course I'm going to vaccinate them. Of course I'm going to prevent these diseases from affecting their lives and their families in the future and their lives. So for me, I felt not just proud, but I felt very comfortable with that decision. I've seen the research, of course. I'm somewhat biased. I'm sat within WHO, but I made what I thought was a very straightforward choice. And I vaccinated both of them according to the national schedule in Denmark, where I live, with the same vaccines that you have access to here. So it's not a question of me, for my children, having better access to vaccines in Denmark than you have in Bosnia-Herzegovina. It's the same vaccine. After my first child received her first measles-containing vaccine, she started to walk, which was a miracle. And then with my second child, actually, interestingly, with my second child, her first words started to come out. It took a little bit of time, but after vaccination, her first words started to come out. And I often tell people this story because they suggest to me that it's only negative things that happen after vaccination. Not in my case. I had a very positive experience with vaccines. And if we're going to suggest that vaccines made my child walk, then I think that's as crazy a suggestion as vaccines cause autism or vaccines are dangerous.